Welcome to the Kauvery Transplant System. Today I am introducing to the viewers the Liver Transplant Program in Chennai, Kauvery, which we have recently has been approved by the government for liver transplantation and pancreas transplantation. As you all know, liver transplantation is a treatment that is useful in management of end-stage liver diseases. End-stage liver disease is a situation in the liver disease where the patient cannot improve his survival by any method of treatment. We say that a person has reached an end-stage liver disease when he develops complications of cirrhosis. We normally do not call cirrhosis as end-stage liver disease, but we have a certain number using a number of tests that help us predict how long the patient will survive with the liver disease. That number is called the MELD number and needs a test that is commonly done in all labs: bilirubin, international normalized ratio, also called prothrombin time, INR, and creatinine. We also use an additional number that estimates the sodium to give us a calculated number called MELD. If the MELD is above 15, there is a high chance that the patient may not survive in the next 3 months without a liver transplantation. We usually offer liver transplantation as a form of therapy to these patients because 50% of these patients will die within 1 year of diagnosis of end-stage liver failure. On the other hand, a person who is offered liver transplant and undergoes a successful liver transplantation will survive for more than 85% at the end of 1 year. This is a substantial increase in survival compared to no treatment. We are currently equipped to provide this treatment to all our patients who require end-stage liver disease. We also should look at the cost factors that are involved in transplantation. Cost of transplantation always has been projected as exorbitantly high, and most of the transplant programs charge somewhere between 30 lakhs to 60 lakhs for the transplantation. Since the beginning of transplantation in India, this has become a major concern for all the key players in the transplant process, mainly the public. As a transplant program, we have decided that we have a social responsibility to address this issue as a very core issue in transplantation. We have looked into all the parameters that decide on the cost of transplantation in order that the patient may maximally benefit out of it and agree to the government costs of transplantation that must be offered to a majority of patients. Kauvery Hospitals is totally committed to good patient care, at the same time provide an affordable platform for transplantation for all our patients. By doing this program, we believe that we may be able to make many patients benefit from transplantation when it is needed in the most sick and tragic part of their lives. We also hope to play a major role in transforming the care of patients with end-stage liver disease, and we believe that prevention is still the best cure, and transplantation, even though it may offer the best cure at the current situations for end-stage failure, we should always consider that prevention is better than cure in most situations. We also take an active part in preventing these diseases by promoting a healthy liver lifestyle, actively searching out problems that can contribute to liver disease by our preventive care clinics, and involving ourselves in public education system. Kauvery Hospitals is also committed to organ donation drive, in that we are trying to promote people who are brain dead to contribute to the betterment of society during their time of grief. We are also committed in the long run to promote transplantation in pancreas, heart, kidneys, multi-organ transplants, multivisceral small bowel transplants, and in lung transplants as well. We are slowly taking this process forward. This is our first step, and we would like the public to benefit maximally from all our plans. Thank you.